Each and every day and week is different for me as a neurointensivist. And so some weeks I'll be in the ICU, which looks totally different than a week on research, which is a much more 9 to 5. I call my own schedule just so the grants get written and the papers get written and things get submitted on time. I have a lot more flexibility in contrast to my ICU weeks, which are much longer days. And so those days I come into the office, I wake up really early and get rounding. We round with the neurosurgeon starting at 7 a.m. and I'm here on campus seeing patients and rounding with my team starting at 7 a.m. and finishing up round sometime mid-morning, and then working with my team supervising procedures, talking to patients and families, and then kind of running around like crazy for much of the day, trying to get a bite of eat, definitely lots of coffee throughout the day, and then returning home probably 5, 6 o'clock at night. And that's totally different than a research week, which is just lots of meetings and writing, but a little bit more of a 9 to 5 schedule. So it's that contrast that really drives me and is really exciting for me, because just when I get very sick of one sort of cadence of life, I get to move to the other, which is a lot of fun for me. For me, it was the challenge of having every day be different. I get bored a little bit easily, and so I needed the challenge of having change a bit of all the time, and the challenge of being able to teach and learn something new all the time. And learning does not stop at the end of residency or at the end of fellowship, nor at the end of the first couple of years as an attending or after you get promoted to full professor. Let me assure you, the learning never stops. I learn as much even from the medical students than I think that they learned from me. And so that was a huge reason that I wanted to stay in academics. And plus, it was going to be very difficult to do the research I wanted to do in any other setting. And so that's a huge reason that motivated me to stay in academics. And it has definitely been the right fit for me and allowed me to pursue my areas of interest and inquiry in ways that I could not have possibly even imagined as a medical student. When I first started in medical school, I was so focused on taking care of patients and just learning how to be a good doctor and figuring out how to navigate my way through the healthcare system and understanding just the basics and fundamentals of patient care. And it was really not until I got pretty involved in residency that I even understood that research was something that I was interested in, even remotely. It was not something I participated in as a medical student at all, actually, and started dipping a toe into it as a resident, and then in fellowship hit my stride and incorporated research as a big part of my fellowship. And that was really fostered and encouraged when I was a neurocritical care fellow. And then my career as faculty really has been very centered on research, not exclusively, but as a huge portion of what I do, especially now in the last 10 years of my life as a faculty member. It's really been the focus and has driven what has, in fact, motivated when I changed jobs a few years ago was really to facilitate research opportunities. And so I just didn't anticipate that when I started off in my career, and it has really motivated how the direction my career has taken, particularly as it has evolved in the more recent years. And again, it's been that challenge that's really kept me engaged and helped me to not get bored. I think that's the biggest take home is how it's kept me engaged. For me, there are multiple aspects. I don't know that I could confine myself to one single aspect that is the most rewarding piece. For me, it is the challenge that presents itself by trying to solve new problems, and those problems can take the form of a challenging diagnostic case or a particularly complex, rocky course of shepherding a difficult disease process or a very complex medical patient through a long ICU stay with a lot of subsequent complications and getting that patient better and to the point where they can graduate from the ICU onto the next level of care. Or it really can be my interactions with my colleagues, and that's brought an incredible richness to my life as an academic that, again, I wouldn't necessarily have identified as a medical student when I was starting out in a career in medicine. I really did not appreciate what the richness it would bring and the pleasure that it would be to collaborate with my colleagues in taking care of patients, in writing research grants together and papers, and how much I learned from my colleagues, and just the joy of being surrounded by really bright, funny, incredibly insightful other colleagues that bring so much to my work, and again challenge me and help me to become better and to learn so much, and I think become a better physician, but also a better scientist. I never would have expected any of those things, and so I think those are huge motivating factors, and I think the ability to work in much larger teams. I think in some regards, I think you could do that in private practice, but I think that there's a structure that's provided by academics. There's a natural ability to have these much larger teams, certainly in the ICU, in which we definitely do not work in isolation. That's a big reason why I love the ICU so much. It also brings together these multidisciplinary teams, and so we're interacting with physicians in surgery and in medicine, and then other subspecialties, but then also in academic departments in neurology. There's such collegiality, and so particularly at the institution I'm at now, there's just this sort of richness of like collaborative work that that makes me deeply, deeply love academics and not ever want to leave it. But I think it's that richness, as well as the constant challenge. Now, sometimes that constant challenge is really frustrating, but it makes things not boring. And I guess the theme so far that I've brought up is that I get bored really easily. So I need that constant challenge to stay engaged and to keep going. For careers in general, I would say that oftentimes careers are nonlinear. It's easy to think that A leads to B and B leads to C and C leads to D, and it's going to have this very linear trajectory, and each year will build on each other, and things are not exactly go in that direction. Very oftentimes the pathway sometimes feels circular, or in a direction that definitely is, whatever shape that is nonlinear, and that is really okay, and you're not failing if your pathway is a little bit nonlinear or non-traditional, or takes you in a different direction that you didn't expect, or circles back on itself, or you realize you start off going in research and then you realize you love administration, or you love education, or you start in education and you find you really love research. It is okay, and in fact pretty healthy, to have your career evolve over time and realize that what you truly love at the beginning of your career might change a bit, especially as you get 10, 15, 20, even 30, 40 years into it. Hopefully we have that type of long career. I mean, that's really the mark of success in my mind, if we can have those very long longitudinal careers. But things will evolve, and that's perfectly okay, and in fact a good thing. And allow yourself to sort of take those journeys and learn along the way. And we learn as much from our quote unquote failures as we do from our successes. I haven't always learned that much from succeeding. I've learned a terrific amount from failing, like a lot. So take those failures in stride. They will make you terrifically strong and resistant to sort of giving up on yourself, and that's the most important thing. Is to we will all have situations in which don't go the way we hoped, and that's absolutely to be expected. So nonlinear trajectories and challenging situations are to be expected. So don't get too discouraged.